talk about something that's very technical, but I think everyone can follow. It has to do with bad metabolism and the outcomes associated with metabolic stress. You see, as you can see in this slide, there is a direct link between improper metabolism and what is commonly called poor outcomes. Poor outcomes include things like disability and death. And if you look at this slide prepared by Clemens and colleagues and presented in Diabetes Care, you see that glucose and insulin in the middle are actually the culprit of all of the metabolic problems that are associated with diabetes. Because when you don't have proper glucose and insulin use, the first thing that happens is, on the right side, you have reactive oxidative species. What are reactive oxidative species? They are the free radical oxygen atoms that go around disrupting RNA and DNA. And this is how you damage cells. This is what you have antioxidants for. And when you talk about antioxidant food, what you're trying to do is stop or slow down reactive oxidative species, also called ROS. The other thing that this inability to properly metabolize causes are transcription factors. Now, transcription factors are the sticky substance that goes between the two sides of the chromosomes, where instead of a cell replicating itself properly, the cell turns around and has an error in the way it makes itself, and so it turns over and it becomes a different type of cell, and it becomes, in a sense, a cell that isn't properly dividing itself. On the other side of that tree is the immune dysfunction. Now, most people don't know that your immune system is very badly impaired when you're a diabetic, and one of the ways you know this is by cancer rates. You see, you have 8 times the risk of pancreatic cancer for the first 3 years, and 4.25 times the risk of pancreatic cancer during your life if you're diabetic. You also have roughly 2.5 to 3 times the cancer risk of all other cancers. And what's even worse is, if you happen to get cancer, your chances of dying from it go up, because mortality from breast cancer, for example, which is a hormone type of cancer, goes up by 38%. So even if you get good treatments, you're more likely to die. Why is that? Because diabetic people have immune dysfunction. And other types of cancers you're more likely to die from. Colon cancer, you're 30% more likely to die from that. So when you first are told that you're diabetic, they nicely don't tell you that you're much more likely to get cancer, you're much more likely to have infection. But the big bugaboo of all, and the reason that we have such terrible problems among diabetic patients, is free fatty acids. And as you can see from this slide, free fatty acids directly cause more ROS, more reactive oxidative species, which injure the mitochondria in the cells. In other words, the cells can't burn or produce insulin as well, and can't use that insulin, I should say. And so with ROS and with all the other problems, you have cell death, which is apoptosis, you have ischemia, which is a lack of blood flow, you have general corporate-wide acidosis, and you have, unfortunately of all, inflammation. And inflammation is perhaps the most horrible part of diabetes, because that's how the rest of the body succumbs. So this technical slide is very helpful, because what it shows is that by addressing the core problem of glucose and insulin utilization in the cell, we can stop all of these reactive oxidative species, immune dysfunction, infection dissemination. We can stop the cellular injury and death, the infarction ischemia, in other words, lacking of blood flow. And we can stop, most importantly of all, inflammation. Because free fatty acids cause inflammation.